Hello there. Today is the 10th of September 2025. 10th of September every year has been marked as the World Suicide Prevention Day. And the theme for this year is changing the narrative on suicide. That theme is actually taken from the year 2024 to 2026. We know that an average of 720,000 people die from suicide every year. And the effect will be described as a ripple effect, because every suicide affects not only the individuals, it affects the family, affects workplaces, affects the community. But we need to change the narrative on suicide. What does this mean to change the narrative on suicide? We know that suicide is usually whispered in hush hush. People don't want to talk about suicide. People don't want to talk about the harmful effects. In fact, in some places, it's like a taboo when somebody dies of suicide, because people will say that people should not marry from that family. There will be the shame and the guilt and all sort of things. And so when we talk about changing narrative of suicide, we are talking about changing issue of the harmful myth that surrounds suicide. We are talking about reducing the stigma that goes along with suicide and the causes of suicide. We are talking about the ability to foster open conversations about suicide with the intention of preventing suicide, and for people who are affected by suicide to talk about it, or people who have issues that may be predisposing them to suicide. And we know that some of the issues, mental health issues that predispose people to suicide, will include things like depression, schizophrenia, things like alcohol use disorders, substance use disorders, and sometimes personality disorders. Personality disorders, especially the antisocial personality disorders, borderline personality disorders, and sometimes another mood disorder like bipolar affective disorder, especially the manic episodes, make people also think about suicide. Now, when we talk about changing narratives on suicide, we include shifting from silence and misunderstanding to open conversations, openness, empathy, and support for people who might be having issues of suicide or people who have been affected by suicide. Remember, we talk about the ripple effect. If a person takes the life in suicide, the family members are going to go through the issue of guilt. The family members are going to go through the issue of blaming themselves, thinking that probably they would have been able to prevent this suicide. And of course, some people are actually going into depression, and there will be sympathy suicide and so on and so forth. But we can prevent this when we have conversations, openness, provide support and empathy, rather than demonizing people who are survivors of suicide or people who have relatives who have taken their lives in suicide. And changing the narrative on suicide will also include creating an environment where support can be given and people can speak out and look for help. Changing the narrative on suicide will also include driving systematic change, like policy changes. For example, in Nigeria, it is still an offense, a criminal offense, when somebody attempts to take the life in suicide. Changing the narrative of suicide will also include changing that law to mean that people who have suicidal problems should be helped to seek help and treatment rather than being criminalized. Changing the narrative will include making suicide prevention and mental health care priority public health policies in all our institutions and by all levels of government. Changing the narratives will include having government institutions to take action concerning the issue of suicide and public health, and mental health treatment, prevention, and management. Changing the narratives will include developing and implementing evidence-based strategies for the prevention of suicide and suicide-related issues. Changing the narratives will include improving access to care, especially to quality care. Changing the narratives will include ensuring that those who are in stressful conditions who need help are able to get the help that they need. We at NetWealth Medical Services and Rehabilitation Center, indeed, we at NetWealth Consult and all our concerns are saying that we should change the narratives in our society, in our families, in our institutions, and anywhere we find ourselves. Help is available. Seek help today. God bless.